So today let's talk about chronic fatigue syndrome, CFS, ovarian reserve, menopause, and fertility. A slightly detailed evaluation. What we now know is that we are steadily seeing more and more women with myalgic encephalomyelitis, that is chronic fatigue syndrome, often experience a range of gynecological and reproductive issues. We know that they have a higher rate of menstrual irregularities, irregular periods, heavy bleeding, missed periods, and gynecological comorbidities in chronic fatigue syndrome. So let's look at the scientific consensus on chronic fatigue syndrome and looking at what goes wrong. So if you have a look at this, you are looking at prevalence of reproductive issues. Those with chronic fatigue syndrome experience a range of gynecological and reproductive health issues, which include menstrual irregularities, irregular cycles, heavy bleeding, and missed periods. There's a risk of early menopause, and it's noted that the average age of menopause in chronic fatigue syndrome was around 37.6 years, markedly less than 48.6 in healthy women. This probably is a potential link between CFS and premature ovarian failure. Clinicians and experts often are aware of these associations. Now, the American Menopause Society noted that chronic fatigue syndrome can take a tremendous toll on women. If you look at certain studies, and the studies are reproductive linkage of looking at 150 women, they found that CFS caused more menstrual abnormalities and signs of ovarian dysfunction. We looked at menopause and a risk factor, and the mean age of menopause was again 37.6 years. We looked at gynecological history, and it seems that there were higher prevalence of gynecological problems and more likely to have a hysterectomy than other gynecological surgery compared to healthy women. And you look at pregnancy outcomes, miscarriage rates were significantly higher after chronic fatigue syndrome. Around 30% of pregnancies in women with chronic fatigue syndrome ended in spontaneous abortion compared to 8% miscarriage rate. If you look at the immune side, you're looking at they exhibit chronic immune system activation and subtle autoimmune features. What has also been seen that there are abnormal cytokine profiles. And while classically it is not categorized as an autoimmune disease, emerging evidence suggests that some patients have autoimmune processes. What's the impact on the ovaries? The ovaries are susceptible to autoimmune, and there is some link between ovarian failure and autoimmune ovarian failure or primary ovarian insufficiency. The human ovary is commonly targeted as an autoimmune attack leading to dysfunction, but this again is something which is not very well known. If you look at the autoimmune connection, there's one hypothesis that suggests that there's an accelerated loss of ovarian reserve, and this may be due to autoimmune problems. And you often also see different autoimmune conditions such as thyroiditis, rheumatoid conditions, and these may again suggest that there is a chronic activation of immune cells might create an environment where the ovary may be affected. So what is also known is that there is a mitochondrial dysfunction, and that dysfunction seems to occur as an energy deficit, reduced ATP production, and altered mitochondrial enzymes, accelerated aging. Chronic fatigue syndrome causes a person's mitochondria to be less efficient and increases oxidative stress, which could probably accelerate the aging process for the ovaries. If you look at ovarian reserve, ovarian aging is tightly linked to mitochondrial function, and oocytes are uniquely energy sensitive, and each egg contains a high number of mitochondria needed to support the early embryonic development. And it seems that the chronic fatigue syndrome tends to affect that. Finally, we're looking at oxidative stress, and chronic fatigue syndrome can directly be cause excessive oxidative stress, impair oocyte quality, and there is with high ROS, it destroys oocyte quality, damage to endometrial receptivity, and that's something which again has been suggested. If you look at chronic inflammation, there are many studies which look at low grade inflammatory condition, and you have seen a consistent high level of cytokines. If you look at the effect on ovarian function, elevated cytokines can interfere with hormonal feedback. High levels of TNF and IL-1 disrupt granular cells in ovaries, leading to poorer production and impaired follicular maturation. There's some studies which suggest that it blunts the diurnal cortisol level and DHEA level that contributes to human estrogen production. And if you look at the impact of fertility, of chronic fatigue syndrome, by disturbing hormonal regulation, damaging ovarian cells, reducing egg quality, it may give rise to higher miscarriage rates and infertility. Now, let's look at the hypothalamic axis as well as hypothalamic pituitary gonadal axis. And if you have a look at what happens, there's a risk of early menopause, irregular cycles, challenges, hypothalamic pituitary gonadal axis, altered GnRH, LH signaling and affecting ovulation, stress hormone imbalance, and that's cortisol affecting reproductive hormones, and the hypothalamic pituitary axis leads to altered feedback mechanism and a disruption. So, in summary, we would say that when you look at chronic fatigue syndrome, studied as a neuroimmune illness, it seems to have a meaningful interactions with reproductive health, higher rates of gynecological abnormalities, including irregular menstrual cycles, polycystic ovaries, endometriosis, and premature menopause. It's likely to interfere with ovarian aging with a combination of immune dysfunction and mitochondrial oxidative stress. From clinical implications, for patients, it underscores the importance of reproductive health care. We would suggest an early testing for anti-Müllerian hormone and antral follicle count, and the awareness that early menopause, premature ovarian failure is a risk. Treatment consideration, I think this has to be worked with a specialist. That chronic fatigue syndrome has challenges in ovarian reserve and ovarian function. And we look at diet, antioxidants, anti-inflammatory medications, and there is possibly the role of coenzyme Q10, but equally understanding the situation and trying to see whether early intervention, like freezing of eggs or embryos, is